All right, questions?
Any questions from, yep. Have we got the mic?
Very exciting and very interesting presentation. I've got two questions, if I may, please. We talked about crossbite correction, where we overcorrect unilaterally. When you go into fixed braces, will the Y sequence correct that overcorrection? Plus the impact of the buccinator muscles. Can we regain symmetry?
Okay, so they're the two questions?
One question.
One question. Okay, so the question is, when you overcorrect for the crossing of the bite, will the braces resolve that? And how do we account for the buccinator muscle activity? Well, in my protocol, I don't overcorrect. Why do you think people overcorrect? Like, why were you trained to overcorrect?
They haven't expanded the mandible as well. It's overcorrected.
Yeah, because everyone expects to relapse. So they make more so that when it falls back, it doesn't fall back so much that you're back to where you started. So I've got a much better retention protocol, expand as much as I need. But I get more than most people because I'm expanding the lower arch as well. So I'm trying to get it perfect. I'm not trying to overexpand. Okay. Now, as far as the buccinator muscles are concerned, so do you know why some of us have full cheeks, some of us have hollow cheeks, and some of us have flat cheeks? Because some of us are babies and we have no teeth, so we need the cheeks to suckle. And some of us are adults with teeth, so we chew and swallow and we don't use the cheeks. But some children haven't figured out how to do the adult patterns, so they retain their full cheeks, and those cheeks compete with the teeth. Right, and they squash the teeth in. Because they haven't transitioned out of their baby cheeks. And it's wonderfully cute, but it is a competition of cheek versus teeth in the mouth. So how do we manage it? We teach them how to do the right things with the space that we've created. This is day 2, right? My exercise program. Now, why do people have crossbites? I suspect it's because they sleep on their fist. And they squash their face in. That's what I suspect. So I asked them not to sleep on their fists. Second question?
When we're doing the maxillary expansion in a vertical grower, a skeletal 3, we can't limit the growth of the mandible. How do you compensate if you're using acrylic plates to try and get that expansion happening? How do you?
So the question is, in a class 3 skeletal pattern, we can't do anything to stop the mandible. So how do we accommodate the fact that there's a lot of acrylic? Well, we have to reverse pull at the same time as we expand. We might not be able to stop the mandible, but we can force the maxilla to keep pace. Class 3 patients need a big face. They've got big tongues, right? Who has ever seen a class 3 patient with a little tongue? So they need a big bottom jaw. What we want is to help them have a big top jaw.
And this needs to happen before they get to CVS 5, 6?
Well, the maxillary growth starts to finish by 11. It peaks at 5, right? So when do you want to reverse pull? At 4.
When I had expansion, I would. Thank you. I just wanted to add that when I underwent expansion for the upper jaw, I would experience relapse because I hadn't been educated about the tongue position. So I had the low-lying tongue. So what was happening is the buccinator muscles are putting that pressure on the upper dentition. Once I corrected the tongue posture, that counter pressure kept as a natural retainer the new width. So I would say that would be, the two essential keys is the expansion, but they have to get the tongue up. You can't miss that crucial step.
Yeah, there's like the vacant space is going to be used one direction or the other. It can either be used by the tongue or the cheeks can use it.
If you're aiming to train the tongue to sit in the palate and you've got the retainers up there, what's your protocol for the retainers? Because obviously, if they're in the tongue space, how do you train the tongue, or is that?
So the question is, how do we accommodate for all that plastic in the mouth if we want the tongue on the roof? Yeah. So that's what we're going to go through over the next few days. But in the beginning, the plates are really bulky and they eat up a lot of tongue space. So people say, oh, how are you going to get the tongue on the roof if you've got a block of plastic up there? And my answer is, that child has spent 7 years without their tongue on the roof. Do you think 6 months more is going to make any difference? Once I've got the space, I'm going to take the bulky plastic out and teach them to use that space. But I'm not going to teach them to stick their tongue on the roof when the roof is like a little itty bitty.
Can I ask a question about billing? How do you organize your billing? Because we've got a little bit of a debate going in our practice about whether we charge people the whole amount up front or whether we charge for the appliances and that fit and then charge per appointment follow-up from then, because obviously it's very variable how many follow-up appointments we have.
So this is again part of a later component of the lecture series, but at the end of the day, your billing decisions are your own. Now, I'll tell you what most practices do. They do monthly installments of payment. That's what I personally do. I do monthly installments of payments.
But have you set the fee at that point?
Yeah, I set a fee.
The whole...
Right, because I've got a vision of what I'm doing. I have a vision of how I'm going to finish. So I know how much it's going to cost and how much I want to charge. See, when you've got no idea when you're going to finish, that's when it's hard to make a decision of how much to charge. Like, do you have any problems charging for a crown?
No, but...
No, because the first appointment when you prep, and then the insert appointment and the refinement appointment. So you've got 3 appointments and you know how long it's going to take, you know how much it's going to cost. All right. But if the question is, you're going to do a full mouth rehab on that patient, but you're just going to do one at a time over the next 20 years. All right. How are you going to charge them?
True. But, with a lot of these children, depending on compliance, some kids are very easy to treat, some are very difficult to treat.
Absolutely.
And so it's a bit variable how many appointments you're going to have.
Yeah.
Like the kid the other day who smashed his expander with a hammer. Like we know he's going to be a bit more of a problem. So how do we know we're going to?
Well, I'm going to teach you how to manage children, right? Later on, I'll do that, but I'll give you a preview. You hand that responsibility over to the parent, right? It's not your kid. You're dealing with the parent. You say, this is what it's going to cost you. I'm going to charge you that irrespective of whether you follow me or not. You don't have to have him wear it. I'm still going to charge you for it. Okay. So if you don't feel like you can control your child, this is not the right treatment for you. If your kid's going to walk around with a hammer smashing things, then it's going to be a very expensive exercise. I have a child who's lost 3 plates. One of them was when I inserted it, 2 hours later, they lost it at the restaurant because he wrapped up in a tissue and they had it thrown out. One they lost in Japan when they were traveling, and one he lost when he was playing football. All right, so I said to the dad, it's going to cost you a lot to get through this, isn't it? He said, yep. I said, do you want to keep going? He said, yep. He said, even if you get no result, he said, yep. Because I've seen what you can do with my daughter who's older. So the answer is, your confidence is determined by your experience. And your experience is determined by how successful every single case you do is. So let me ask you, when you're starting this, do you want a kid who smashes his plate with a hammer?
No, you can't always predict that.
Yes, you can. Yes, you can. You tell them, I've got parents who let their kids smash their plates with the hammer. Are you that family? And they said, well, he's done that before with other things. Like you come up right at the front and you say, look, it's going to cost you $9,000. You've got a 2-year payment plan system, but I've had families who let their kids smash their plates with a hammer. Are you that family? That's what I actually say. Like, this is what we need from you. Are you going to be able to meet that requirement? And they either come back or they don't. Good. Okay, so we've got some questions from.
Can we just do another 5 minutes before wrapping up? We're on time, but
Yeah.
that's we're going to go behind.
Yeah.
Maybe answer a few quickly these.
So there's a question on expanding the lower arch. What does it do to the condyle disc position? I'm not asking people to posture out of the socket. I'm just leveling, aligning the curve of Wilson. So it does nothing to the condyle position. Next question is, once you expand and you get the desired width, how long do you have the kids wear the retainers? So that's covered in other parts of, see, we're only not even halfway through the first day. So I will hopefully have all the answers for you to come. But how long do I have them in retention? Depends on how old they are. All right. My goal is to make sure that they can avoid braces. So how long do I have to hold that space until all the permanent addition comes through? Like when you finish an orthodontic case at 14, how long do they have to wear their retainer? For the rest of their life is what you write on the contract, right? Indefinitely, forever. So why are you fussed about, oh, those kids, they have to wear a retainer for 2 years? Well, if they have braces, they have to wear a retainer forever. Another question, how do you manage the appliance in mixed dentition period, especially when the primary molars are exfoliating, or also in cases when you have lost teeth due to decay? How do you get enough retention? Yeah, and that's part of the magic of what Enrico does for me. You see, do you lose every single tooth in your mouth in the changeover? No, of course not. The sixes are still there, the centrals are still there. You are allowed to clasp permanent teeth. So you can clasp the molars, you can clasp the incisors, and you can hold that leeway space until the teeth come through before you let that go. Yeah. And you have to know your sequence of exfoliation. Right? You need to know the A's come through, then the B's come through, then the C's, the D's, and the E's. And then when you're changing over, what happens? The sixes come through, then the ones come through, then the twos come through, then the lower threes, and then the upper fours, and then the lower fours, and then the upper fives, and the lower fives, and then the upper threes, and then the 12s, somewhere in between. And then the third molars come through. And you need to know that it starts at 10, and then finishes at 13, and it starts at 6, and it finishes at about 9. Right? You need to know this. And you need to read your x-rays, and you need to know exactly what you're dealing with, and you need to know how long you've got with each phase. And if you don't, you need to do homework before you start treating patients. If you can't recite the sequence of eruption, the timing of the eruption, the length of time you've got those teeth, you shouldn't be doing this. Okay, so that ends Q&A.
Okay, we'll cover the other questions a bit later. So that's all for this bonus Q&A.